Today we're going to go over knot tying and suturing. Before we get started, just know that some of these techniques, the hand tying, are pretty difficult to learn even from watching a video, so you might actually have to sit down with someone, another med student, surgical resident, whoever, and just have them show you right there when you're doing it. The other thing I want to tell you is that for the suture types, I want you to think of, for each type of suture, is it absorbable or non-absorbable, and is it monofilament or is it braided? Monocurl and bicurl are both absorbable types of sutures. The monocurl is monofilament and the bicurl is polyfilament. For the non-absorbable type of sutures, silk is the most common braided suture, and then for non-braided, for the monofilament, a lot of people either use Prolene or nylon. So try and remember one suture from each type of category and then add into your knowledge base after that. So to start, I recommend you just know that monocurl is absorbable monofilament, bicurl is absorbable braided, silk is non-absorbable and braided. Then for the non-absorbable monofilament, either remember nylon or Prolene. So let's get started. If you have an instrument kit and some sutures, go ahead and get it out, and we'll go over a bunch of stuff. Alright, first we're going to go over tying a two-handed knot. I'll start out by tying with my left hand. I always start with the thumb over there, just so I know, just to be consistent, so I know how many knots I've done. You come over here, pinch your fingers, go towards yourself, pinch the suture, bring it away, and then when you tie, you can cross your hands and lay down the knot nicely. Now we're going to do a gun, which is where you use your index finger here, pinch out, in, and down, and you want to push down with your finger to make it nice and tight. Then you do a thumb, and go down like that, then another gun. Another option you have when you're starting off is to do a surgeon's knot for the first one, which is good if you want to put a little tension on the tissues to bring them together, like maybe you're doing a doing a skin suture for someone that got a laceration and you want to bring those tissues together a little bit. So to do a surgeon's knot, you go out and then you go back again, go through the loop again, and essentially you've done two little knots right there, and you can make it look nice there. And you want to make sure you pull the knots down evenly so you get it to lay down nice and flat. That one is a little bit off. Let's see if I can do it better for you. There we go, that looks nice. And then you just go ahead and do the gun. You can also do this tie with your right hand. You would do a thumb over here, go out, and then do the gun, go out. So we'll do it kind of slowly in case you're trying to practice along back there. So you go over, pinch, go in, pinch, go out, and then you turn and go down. And you start like this, pinch, and here it is with your right hand in case you want to go with your right hand. Go over, pinch, pinch, and go out. And then you're going to do a gun, which is where you go here, pinch, go out, go down. This Ethicon kit is actually available for free on their website, so you can go ahead and just order that. We'll do a one-handed tie now. You're going to pinch here. This is how I do it. You go over, and then you want to pinch under here and go down. And then for the second one, I hold it here, go over, pinch here, and go down. Pinch, and go down. Then with the left hand, you would go over like this, pinch, and go down, and kind of do like an underhand one. It's getting kind of short. So there we go. Alright, and those are your two-handed and one-handed knots. Alright, now this cup here is used for tying, for pushing knots down into deep tissues. So if you're doing, for instance, like an umbilical hernia, or if you were doing an open case deep down in the abdomen, you'd want to push your knots down. So you can go down and push them all the way down to the tissue. And that's where you can practice using that right there. Alright, now we're going to do some simple interrupted sutures. An example of this would be if someone comes into the emergency room and they accidentally cut themselves on the finger, maybe the arm with a knife. You could do some of these sutures just to bring the skin together, then send them out. When you're holding the needle, you want to hold it pretty close to the tip of your needle driver. You want to hold it towards the back, not too far back. And then also you can either have the needle perpendicular to the needle drivers, or you can angle it up a little bit. When you angle it up a little, it will give you a little more reach and make some of the tissues easier to get to. So essentially all you do, and these are pickups without teeth. I don't have any of the Adsons or power pads, but Adsons or power pads are good for holding the needle and for holding the tissues without crushing them. So for these, you can either take the tissue in 2 separate bites, or in 1 bite. So this is 2 separate bites. Go over here, pull the tail through, and then you could tie a hand tie, or if you're trying to conserve your suture, you could do an instrument tie. Once around, like this would be a regular knot, or if you go around again, it's going to be a surgeon's knot. Bring the tissues together there, and go back again. And this is a silk suture, so you could just do 4 ties, and that would be fine. And then when you're done, you want to cut. Since this is outside the skin, it doesn't matter how long the tail is, so just leave it about 1 centimeter or so. That stitch is a tad bit crooked, but when you're doing this, you want to try and make everything symmetrical. So you go here. Now if you want to do it in 1 bite, you can actually just come through here and take it both in 1 bite. Try not to touch try not to touch the tip of the needle with your pickups, because you'll dull the end of the needle, and it'll be more difficult to get through when you're getting on the last couple of these. Tip, through 1, 2, 3, and look how I'm pulling the tail to the other side. The tail's over here. Every time you go, you want to pull it through to the opposite side. 4. And then you would do as many of these as you need to. Cut it, and then if you want to, you can pull all the knots to one side. First, it's just a little nicer than having them in the middle. Either pull them to the left or the right side. Next, we'll do a horizontal mattress suture. For the horizontal mattress suture, what you want to do is you want to go here, 1, 2, 3, 4, and then this will be over top of the skin, and then your knot will end up over here. So I'll go ahead and do that down here just to show you. I probably won't take that much tissue. This is good for approximating skin and everting the skin edges if you have a patient that you don't think is going to heal well. That's one example of when you would do it. The other thing you want to make sure is to minimize your needle transfers. As you can see, I'm going to pick it up once with the pickups and then right back to the needle drivers. Now at this point, we need to reverse the needle, which you can actually do just by rotating this needle around here in your pickups. You don't actually have to let go of it. Then click it, and you're good to go. There we go. And tie it down here. I'll do a surgeon's knot again. This foam actually will pull through if I go any, if I put any more tension. But if you have a foam that's a little bit stronger that you're using, or if you're using some pig's feet, you'll actually be able to get nice eversion like that, which will help, which helps make everything heal up nicely. The other thing that you should know is when you have the pickups here, to undo the pickups in your right hand, you want to push on the bottom along this ridge here. That's going to help unclick it, is by pushing right there. And you actually don't ever have to put your fingers in the holes to use them. You can actually do everything in your hand in terms of picking up the needle and anything you need to do. You can just come in like this and pick up the needle. You don't need to use the holes, and sometimes it's a little bit quicker not to use the holes. Now in your left hand, it's kind of the opposite. You have to push on the top of the instrument to undo it. So in your left hand, you kind of got to reach up to the top, and it's a little more difficult. But you should practice it with hemostats, and with they make smaller needle drivers too. You can practice with, and it'll make everything easier if you can do things multiple ways and with both hands. You can carry these around with you if you can get a pair. Just practice all day. Next type of suture to show you would be the vertical mattress. With that, you're going to go far, deep. So you're going to go 1, 2, 3, 4, and then you'll see the suture will be above the skin there, and that's where you'll make your knot right there. It's another way to approximate the wound edges nicely. So we'll go ahead and show you that. Another thing I recommend, unless you're really in a bind, try not to touch the needle with your hand, just to decrease the chance that you stick yourself. So when we're doing this one, we'll go up here and do far. And then for the near, you're really just trying to get, you gotta reverse the needle there too. A couple millimeters of each side. Not a whole lot of tissue there. And this foam isn't the best for demonstration, but it's what I could get. So you go here, and then you get the end. And then cut. So if we can zoom in here for you, you can see how I started here and then came out here, then went in there and came out there. So that's basically that one. Another little bit of information is when you're picking up the tail on these to pull the suture through, you need to make sure that you grab way back towards the tail of it. So if I'm doing a simple interrupted, when I go to get the tail, what you don't want to do is you don't want to grab the middle of it or the front. You ideally want to grab back here towards the tail. But if you grab here, what you're going to have is you're going to do your knot, and you're going to kind of get stuck a little bit. So what you want to do for that is you want to put your needle drivers in here and just pull the tail through. That's how you take care of that. But if you go ahead and just grab towards the end of it, you don't have that problem. Knot will slide on nicely. Next, we'll do a running stitch. Starts off the same way as the simple interrupted, and you want to tie the knot down first when you go. So it's either called a running, or some people call it a whip stitch or a baseball stitch. For knots here, you just want to cut the tail end. You don't want to cut the other end because it's going to be running. Then you're going to want to pick the needle up again. and all you do is you essentially just keep doing the same thing. You actually can do these one-handed if you want. You just go through, and then here you kind of bring it through, and then you can pick it up again with the needle driver back here. Go through for your next one. As you can see here, if you do it this way, you actually get diagonals above the skin surface. The patient will kind of see some diagonals. Another option is, I'll show you here, you can do the diagonal under the skin, which I'll show you, and that way the patient doesn't see any of the diagonal part, they just see the straight across part. So you can go in here and do the diagonal under. Just looks a little bit nicer, but either way is fine, and we'll get everything done. But you can see at the top too, I did the diagonal above, and here I'm just doing the diagonal part below, and they come out straight above. When you're finished and you're ready to tie it off, you just do one more, and then what you're going to want to do is you just do a regular knot, and you grab the center of this here and bring it down. It brings all those three final pieces together. 3, 4, and then when you cut it, you bring these up here and just cut them all off right there. Now when you're cutting these out, you don't want to leave any pieces behind, so down here you just need to cut one of these, and then this one, and that knot comes off. And these all, this would be like in the office when you're removing everything. These just come out like that, and then at the top you only need to cut it in one spot. If you cut it in 2 spots like this, you could leave a piece behind. Just one spot, it all comes out nicely. Now the last one we'll do is a running locking. It's pretty easy as well. All you do is you start off just like you're doing simple interrupted. Grab the tail. Cut the tail. And you just go ahead, and then the difference is that you put the suture over here and you pull it up like this, and now you've locked it, so to speak, and it just provides a little bit more tension on the tissues. So when we go through here, usually you'll have someone following you and holding the tension there, and then you want to go like this so that you're locking yourself. And we got the needle. And then you'll have someone following you right here. Go ahead again. Grab the needle. And then when you're done, you do the final one. And just like before, you go here, grab the middle of the loop, and tie it down. And go back again. 3 knots, and then 4. And when you're done, cut all 3 of them. And then same deal when you're taking this out. You just cut 1, 2 down here. These all come out easy. Then for the last one, just cut 1 string, and you're done. Now we'll do a subcuticular stitch, like if you're closing up the skin. Usually you'd use a 4-0 monocurl for this. I'm using a silk just because you'll be able to see it. The monocurl is clear so that it doesn't show through the skin, but I want to make sure you're able to see this here. First step in doing the subcuticular stitch is anchoring it here. So we'll zoom in a little bit and we'll show you how we anchor it. There's 2 or 3 different ways. This is the one I like to do. You're welcome to do other ones you see people doing. Just come through here, go deep to shallow, and then when you come out, you're coming out right under the skin as well. Pull the tail through. And now you're going to go shallow, which is right under the skin, to deep. And by deep, it's just a millimeter or 2 deep. And we pull the suture through. Now, as you can see, when we go ahead and tie this down, the knot's pretty much not really going to be visible, hardly at all. Oop. If you find yourself with too short of a tail, you can always do an instrument tie, which would be a little bit easier. And you could do, if it's monocurl, you could go ahead and just do 5 knots. If it's vicurl or silk, you could do, I usually just do 4. Now that we've got it anchored, and we can kind of show you here, you can see all the knots anchored pretty far down low. We're going to go deep and then superficial. Deep to keep the knot deep, and superficial to, because we're going to be sewing up right underneath the skin here. And we've anchored the knot, and it's way down there, which is good. When you come to do your bite, you want to go straight across from where you came out previously, and go ahead and travel a little bit. Usually when you start off at the beginning and end, you take smaller bites. Towards the middle, you take larger bites. And that looks nice because we pretty much off a little bit, but pretty much came right across. For the next one, you want to go right across, travel a little bit, come out. There we go. And do one more. Now when you get to the end of the incision, you're going to want to tie a knot down to keep everything together. So I'll do, you can do a couple small bites, so I'll do a small bite here. And then when you're done, you can actually go, I'll come out low, deep, and we'll use that to tie our knot deep. So I went in just below the skin, then came deep to tie the knot down there. So now on this side, you want to go deep, deep. The knot that we tie is going to bring all 3 of these, that one and these 2, the entrance and the exit from this needle right here. It's going to tie all those down. So we want to tie the knot deep, so you should take those last 3 bites a little bit deep. So when we tie the knot, we are going to pull this through, and then the bottom one right here is what you want to pull up on. That's going to bring everything together. So that's this one right here. And that brings the knot together and slides it down. Then you're going to do it again a second time. Some people do it 2 times, some people do it 3 times, and some people do it 4 times. I like just doing it 2 times. And then when you're done, you put the needle through this loop here, and then you pull it tight. and that knot actually is now tied down. So now when you're done, we've got the knot in there and it's secured down. What you want to do is bring this out to the side. So you're going to go through there, not getting any skin, then actually just come out to the side. There would be skin over here. And you would pull it through like this, and that knot's way down onto there. So you got the skin together and the knot's buried. Then you take this out the skin here, pull it up, and cut it off. And you've got a nice subcuticular stitch.